Hey everybody, welcome to NurseChat. We got Nurse Gwen, they can introduce themselves.
Nurse Jackie.
Nurse Rachel.
So we are just going to be here talking about things that's going on, current events in nursing, how they pertain to the community and African American nurses and African American society. While we're doing that though, we're eating, okay? Y'all got anything specific you want to talk about before we get to the topics that we discussed already? Anything? Anything? For Black History Month? No?
No.
Okay. They ain't got nothing to say. Our month's winding up today. Today's the last day. Happy Black History Month. Excuse me. I guess we're going to first start talking about the coronavirus. What we know, what we don't know, and how people are being affected. Listen, I'm scared. Every time I do a physical and they start that sniffling, I say, honey, have you been out the country? Anybody else been out the country? Because you don't want to offend anybody, but you got to know.
Yeah.
With the world travel, people travel all the time now. And so, what can we do to change that? I mean, should we shut off all travel?
No.
Out of the country? Why? You got a trip planned?
I got a trip planned.
Where you going?
Turks and Caicos. But it's not till July. It's not till August. But, I mean, I understand the concern. And at first I was like, oh, it's just like the flu. I wasn't too worried. But the media is just like hyping it.
They are blowing it up.
So it's making me more concerned. But I think a lot of it is, I ain't going to say it's propaganda. But, I mean, if you're immunocompromised or, you know, you're older or you have like a chronic condition, I think there's a cause for concern. But I think most people who are young and healthy are probably okay. But just take the precautions. And
which are what?
if you're sick, stay home.
Wear the mask. The
Well,
specific, it has to be the square mask. What's it called?
Well, today they said you only wear a mask if you're sick. And if you're sick, it's just the regular mask. It's not the N95 respirator mask. So
when did they change that? Today?
That's what I read today.
Okay.
So they said that the mask is for people who are already sick to protect others.
Okay.
If wearing a mask is not going to protect you from acquiring the virus. So
it's just basically hand washing, wearing the mask.
exactly. Stay home if you're sick.
Where you guys start?
Just the misinformation and the confusion that's going, like now the head of the CDC is not allowed to address the public with any updates. They have to go through the administration first before anything's allowed to be communicated any longer.
Sounds like a communist state.
That's it. That's it.
It really does.
It's too late now. They didn't put it out there. People are hysterical.
It is. And I mean, it's a virus. So one, we know there's no cure for that, at least not yet.
Right.
And it has to run its course, whatever it is. So I think people need to stay as healthy as they possibly can and stand up precautions for now. The normal.
But the coronavirus has not been something that just started. It's been around. And I don't know if you guys opened your email, but like if you look on the side of your Clorox bottle, it says kills coronavirus. Now this corona, 19? I'm not sure because there's no clear facts about how long. Now they're saying you can get it from a surface. Before they weren't sure how long it could be on the surface before you can become contaminated, but now they're saying it's a possibility that if somebody touched something and you touch something that you can get it.
It's a vector, yeah.
Right. But I lost my train of thought. Okay, next.
But I would believe that's how either it's possible to be airborne in some or droplet.
Droplet, not airborne.
Yeah, because the person in California that's now positive has not been out of the country.
Community acquired.
And so they don't know how this person acquired the illness. And so, but then one of the other things is that this person lived near the air base where the evacuees who were positive were brought back into the country.
Okay.
So what is that? But then now we know that they weren't even adequately trained and or given the proper
precautions,
protective equipment.
Because they didn't know. But they said it's like a form of SARS. Do you remember when SARS hit? Was it China? I don't want to say.
I think it was China. That's when
Yeah.
everybody started wearing the masks.
Yeah, they were saying something about it being like a form of SARS, but I'm not really sure. But that's what I read. There's so much information out there and it's changing.
It's kind of ironic, though, that all of a sudden, when we're having a problem with China now, here comes the coronavirus in China. But, you know.
Don't y'all worry, I still got your lashes. They're still coming. I will sanitize them down, honey, and get them on the website, okay?
And then also, the other thing that came out this week, which was untrue, was that Africans
Oh, here we
and
go.
of African descent are immune to the coronavirus.
Are
which
you
is,
kidding me?
It's not true, but that was.
Well, I wish it was.
I didn't hear that.
Yeah, that was being circulated.
I wish it was. Can we win on something? we proud of diabetes, hypertension. Can we win on something? Sheesh.
It's terrible.
Okay. So, we discussed the precautions, the coronavirus. It's going to mean, wow. I'm so glad I don't work in the hospital anymore.
Yes.
Because when that H1N1 hit, it was crazy. But there's no confirmed cases in Pennsylvania, from what I know,
There's not. Yeah.
in the coronavirus. So,
Yeah.
keep Pennsylvania state great. Keep the coronavirus away. All right, moving on.
Well, I have one.
Okay.
So there was on social media, on Reddit, it's called "Am I the Asshole in the Room?" And long story, it was a guy who his child, he provided an EpiPen at school for his child, and another child was experiencing an allergic reaction, and they had to use the EpiPen. So he wanted the school to reimburse him for the EpiPen. So there was just some debate on social media that the school stole the EpiPen, and I think that for me, I was just like, this is a life-threatening situation. You do whatever you can, but people were really like, it should not have been used. So I mean, I think as nurses, we all understand, that you have such a limited time frame. But that was, I mean, obviously, I think the school should reimburse it, or the parent of the kid's life who was saved. I mean, somebody needs to replace it, yes,
right.
but. The parent was not wrong for wanting that, but just some of the reactions that I saw, was like, it was stolen, that they should have gotten permission before using the EpiPen. I mean, you don't have time.
Right, you don't have time.
If it was your child, you would have wanted them to use the EpiPen
Right.
on your child.
Absolutely.
And as a nurse, if a student can breathe in somebody's asthma inhaler, their inhalers there, I'm using it. So we're going to protect the life first and deal with the consequences later.
Right.
Absolutely.
So people say anything, but if it was your child, you would have asked, why didn't you use it?
Exactly.
And the parent whose child's life was saved should have been grateful and willing to pay for. It shouldn't even be.
So aren't they supposed to, especially because are you a school nurse? So you guys, when a student comes and has allergies, are they not supposed to have those things available?
Well, we do have, in our school district, we have emergency EpiPens. We don't have, we do, don't you?
Not yet. Don't put the
Not yet. But we don't have emergency inhalers. So it wasn't our school district. It was just, somebody. I think they were in California. I could be wrong. But yeah, every school should have it. But even we only got it within, I would say, the last couple of years. It's just become mandated, yeah. And then something I saw said that they should be in the defibrillators. That I saw that on I'm sorry, that was something else. That was Narcan. They wouldn't put Narcan in all the defibrillators.
They should put an EpiPen in there.
They should put an EpiPen in there too, right?
And an inhaler.
Absolutely.
We're going to stop it. Let's
No,
get out.
When you think about it, those things that need to be done quickly
Yeah,
should be with
accessible,
yes,
right? Yeah,
absolutely.
Have you ever used Narcan?
yeah.
I've never.
I've never had to.
No, I've never had to use Narcan. I just remember the horror stories where people said, like, they're pooping everywhere, and yeah. This is years before it was the up your nose, the IV.
When they were giving the shot, the IV.
Or was it a shot or an IV?
A shot.
A shot.
So I'm giving a shot in the nasal one. I mean, they come back and they're very upset
Very upset.
that you have ruined that experience for them. But I haven't had any like loss of bowel or bladder or anything.
Okay. I never had to give it. It was just something that I heard, but we do stock those now. Norcan.
Isn't it amazing?
You know
They
why we
stopped
stock.
marking them.
Yes.
But not EpiPen. I mean, inhalers. Okay.
Oh, yeah.
Yeah. And you can get Narcan for free.
Mm-hmm.
But diabetics can't get insulin. Like, we could start
You
this
can't
all
get EpiPen
day.
for free.
Listen, you can't get EpiPens for free.
What about the pharmaceutical company, the woman who raised it up 600%?
Didn't she get fired? Did she get fired?
She probably got promoted.
She was...
A bonus. Right.
Milan in West Virginia. I think that was the company.
She was the CEO or something.
Yeah.
Mm-hmm. Terrible. Terrible, terrible, terrible.
So what else has been going on in nursing?
Mm.
Anything? I want to say one state just, was it DC or Virginia? Who did it? Well, nurse practitioners, they passed for them
Full
to practice.
practice. Well, I know they did it throughout the VA, but there's a lot of
It was the
states that-
VA.
The VA.
It was the VA. Mhm.
Yeah, and I heard the physicians are pissed.
Well, listen, I heard that the VA, at the VA, the nurse practitioners don't have, like they could work on a unit. They're not used as NPs.
I think it depends on where you're at, long term versus. I mean, I don't know, but that's what I had heard. It really depends on where you're at. I don't know.
Okay. Well, the main thing I wanted us to talk about was all these nursing schools, and I guess they're basing them just on hospital-based schools that are failing nursing students, right? I don't think it's just hospitals. I think it's a lot of schools. I know when I went to school, they told us to look around. Half of you won't be here at the end.
Absolutely.
And they were absolutely right.
Mm-hmm.
So, I mean, what do you guys think about the write-up that was on what, WTAE?
Mm-hmm.
About nursing schools failing nursing students, and then they're getting kicked off the program.
I don't think the schools are necessarily failing the students on purpose.
Okay.
I truly believe that we've all been through it. So it's not easy. Mm-hmm. And I think some students probably come in it with the misconception that, I'm going to be a nurse. Well, guess what? I remember when I went to school, they said, look around and you will not see everybody here that's going to graduate with you. I went in doing the accelerated program. There were 86 CCAC.
Okay.
There were 86 of us that were accepted into the accelerated program. That's not including the day program and the nights and weekends. Graduation, there was 100 students from all three. That was it. It wasn't easy, but I mean, I think sometimes people just assume that they can. You go to school, and most people, when they pay to go to school, they usually graduate with the degree that they went to school for, unless they just slack off most of the time. But nursing's different.
So you guys don't think that sometimes schools make it difficult?
I think that nursing is difficult, and when you're dealing with somebody in their life, that it should be difficult.
Absolutely.
And so, if you can't pass a dosage calculation test, then maybe maybe you should reevaluate whether or not this is for you. And I don't, it's one thing. I understand school is very different than clinical practice sometimes, but I think you have to have standards. And so we were kind of talking about how in nursing, a lot of times diploma nursing may be the only clinical nursing you get, particularly if you go for a higher degree. So you have to have a good foundation. You have to have an understanding. And if you don't, I don't know what to say. I mean, is it hard? Yeah, but anything that's worth anything is hard.
And especially, we are responsible for lives. It should be hard. Mm-hmm. It should not just be something that anyone who raises their hand and says, I want to do that. Because I know there are some people that I've even heard when I was going to school, it was about the money for them. Mm-hmm. It was not about doing the job, being there for people, educating people, caring for people. It wasn't about that. And guess what? Some of them made it through.
But those are the people who get burnt out and
Absolutely.
leave because they'll never pay you enough for all the work you did. You'll never your workload will never match your salary. Well, maybe now. Maybe now, but I'm saying when you working in long-term care, when you're working in acute care, you work. And I think people, and this is another thing that people do. Everybody thinks, these younger nurses think now, okay, I'm going to graduate and then I'm going to go work at an ICU because I only got 2 patients. Like, that is the trend now. I think everybody should work on the med-surg floor. I think everybody should have, because med-surg now isn't just med-surg. Med-surg is psych. A large component of it is psych. Almost everybody has some kind of psych diagnosis along with whatever. And it may be drug, alcohol as well with it. So, I think everybody should have that experience. I started off on neuro and ortho surgical. When I went to, so that's specialized. I was good at that. So I was just saying, like, when I worked on ortho neuro, that was specialty. I knew how to give my, take care of my patients' wounds, get them ready for surgery, post-op, all of that to get them out the door. But when I went to med-surg, those people were staying. And they were staying for a while. Well, that's before they start kicking you out one day. And they had multiple things going on. You know what I mean? So it was so much more. But I also always temped in nursing. So I temped at Canterbury. So I had that whole senior population experience as well. Man, I think I've done so much in nursing, and I think that people need to be well-rounded in nursing and not just say, I'm going to the ICU. Because some of these kids that work in the ER and work in the ICU don't know what they're doing. Like, if I go to the hospital, I'll be like, you got to wipe off my IV. You have to do this, this, and that. And I don't think they have that critical, CCAC there. Critical thinking. And critical thinking, you have to be a prudent nurse. That's all I heard through everything. So I just think that, they're never going to pay you for what you think what your work is going to cost, I guess, because it's going to cost you something. So you have to love nursing. And, I got off point, Chris. You're going to have to cut that. All right. Was there anything else y'all wanted to talk about with the nursing and nursing school?
Well, just in terms of nursing school at the advanced practice level, like I'm in some of these Facebook groups, and so there's a proliferation of online nurse practitioner schools, and that's becoming, some people see it as very problematic. And people who go to these schools are very protective, I understand, but I think there are some issues with this, and so I just think that nursing as a whole needs to just look at like where we want to go, and those standards I think are pretty lax sometimes.
They have been though,
but they're really lax. I think in some cases, and I just think that as a profession, that's something that they're going to have to address long term, because get your paper, do what you want to do, advanced practice, all that I think is good, but from a holistic perspective, if you're graduating nurse practitioners and they're not necessarily prepared, and I'll just say my experience with an online school is that there was a nurse who I worked with who was in a program that was online, and she was working as a nurse and using those hours as precepting hours for her nurse practitioner, which is, first of all, unethical. Wow. But also which counted, and she graduated, so she was able to pass her test, but she didn't have that experience. I mean, I have a lot of issues with like the whole process in general, because I think that our education is not consistent, because your preceptor may teach you something and my preceptor may not, and so you can't, I want to advocate for my profession, but let's also be realistic in that there are sometimes some differences in skill level and competency. And I understand that when you come in, it's a basic competency that you're not expected to know everything, but it does make a difference. So I'd like to see as a whole, just like you have certain things that you learn in nursing school, whether you're bachelor's, diploma, or associates, I think those standards should be at some point incorporated into the MP programs too.
But isn't that, first I wanted to say 2 things. But do you think that Duquesne, which is a well-known school, do you think their NP program is good? Because that's where I started, and it was all online. I am not an online student, so I had to leave. But they have a online NP program, and then you have like a week or two of clinical.
I mean, my program was a hybrid program, so some of my stuff was online and some of it was
Right,
in
that's
person.
how mine was.
So for me, like my preceptor, my instructors from my school showed up to where I. So you verified where I was and what I was doing, and that my objectives were being met. I don't. If you're an online learner, you can work it out. That's fine. Everybody learns differently in terms of that part, but I just think the clinical part needs to be consistent, because you could be a visual learner, you could be an audio learner. Like, there are different things, but when that clinical piece comes in, I think it needs more consistency at that level.
And I agree with you, because I've worked with some NPs who I wouldn't let touch my dog.
Yeah.
I'm serious. Mm-hmm. You go to school and you just learn that, you just go all the way through, and then you become an NP, but you've never worked as a nurse on the floor anywhere. And so there's none of that dynamic with patient interaction, family interaction, let alone the staff you're working with. Like, it's just really, it can be really challenging. And then you have patients coming to you saying, they don't know what they're doing.
I'm sorry.
But yeah, it's, I think there should be a standard. If you've never worked on a floor as a nurse and you go straight through and become a nurse practitioner or whatever, even with the BSN or just you need some time on the floor. You need to be able to interact with patients, with patient families, with other staff when there's something. Like, what do you do when there's a crisis? If you've never, I remember when I became a nurse and something broke out on the floor, and I'm like, oh, we got to go get the nurse. And they looked at me, they were like, Jackie, you're the nurse. But you know what I mean? So if you're like, what do you, just my last job, we had a nurse practitioner. She's a provider. She's seeing patients. She kept coming and asking me, well, what am I supposed to do with this? Well, can you take a look at this person and assess? That's your job. I believe it needs to be that standard.
But let's just say nursing as a whole needs to have some standards. And when I first got into nursing, that's what they said. They said our profession is not respected because there's so many different things. You can go to a diploma school, you can go to a 2-year school, you can go to a 4-year school. Not all nurses are required. Because when I first became a nurse, they said by 2008, here I'm Russian, every nurse is going to have their bachelor's degree. Do y'all remember that? They were saying every nurse was going to have their bachelor's degree because they wanted all nurses to be on the same thing. It's going to be a requirement for nurses. Well, I'm not advocating for everybody to get their bachelor's degree. But if you're saying that and you want us to be respected because we all have this, then we need to do that. I commend UPMC because for a while they were making all of their nurses, their supervisors, become clinicians, I believe. They had to go to school for advanced practice nursing. They had to do that if they were clinicians in the hospital. When I worked at Montefiore. I don't know if they still require that, but they did. But in nursing, if you're a doctor, you're a doctor. Do you know what I'm saying? You have to go to school for 8 years or however long to become a doctor. And I'm not bashing nursing because I started at CCAC and continued my education. So I was thankful for that way you had to go. But I'm just saying, if you want us to be seen as a profession where everyone has the same education across the board, there's consistency.
Would have to really do some changes.
Yeah.
They really would.
Yeah. You noticed that when nurse practitioners first came out, we were the only ones who could be could write scripts and we could work on our own. You know, them doctors got that changed. You know that. Like, PAs can now write scripts without their doctor being there. When I was on, they can write scripts.
They can write scripts,
but they have to be co-signed.
They still.
But then 24 hours or 48 hours. They're supposed to be. I think. I'm almost positive.
So
I'm gonna double check it.
no, so where I just got finished working at Squirrel Health Center, our PAs wrote scripts.
Yeah, you can
They
write script.
did the controlled substances and called everything in, and now everybody has the e-script.
Yeah.
But our chief medical officer did not have to co-sign off of them because everything was up underneath that license anyway.
Okay.
So there was no, after so many hours that they had to co-sign. Yeah. And the MPs just do what they need to do, they just write.
I don't know.
But now it's, you can't even have a master's degree and teach nursing anymore. You have to have a DMP.
Yeah.
Yeah. And that's how the nurse practitioner program is going. And that's how pharmacists, you gotta have your PharmD. PT? You have to have your doctorate. OT, you have to have your doctorate. They're starting to require it in a lot of things. I'm glad I got out of there before they required that. But they were supposed to grandfather us in, so I'm going to be calling Carla at university. Where's my paper, Dr. Lane? I want my DR, PhD. This cheesecake is too sweet. I didn't ask for this.
You did ask for that.
That's a lie.
You said, give me Oreo. That's a lot. And then they give you a big Oreo cookie.
That's too much. So, we're just going to wrap it up. But did y'all have fun at Seven Springs?
Yes.
Everybody keeps saying it should be an annual event.
It should. It was fun.
That would be
But
nice.
should it still be there?
Surprisingly, I liked it. I mean, now listen, I'm not a cold person, so I didn't really partake in the outside activities, but I had a good time.
That's good.
I'm like, where else you going to go skiing at?
Deep Creek.
Oh.
I love Deep Creek. It's pretty.
That's it. I've never been.
And it's
Do they have a facility like that?
they have snow tubing and
She said the facility.
Like,
So like
we
Seven
all-
Springs, everything's in Seven
They're
Springs.
ignorant.
You don't
Let me
need to
just
get out.
see
You don't have to go outside for anything at Seven Springs. Everything's right there.
not like that.
Okay.
Well, let's
Okay,
keep it
Seven
at Seven
Springs.
Springs. 'Cause we ain't going outside. That food was whipping.
It was so
Wasn't it?
nice.
Yes, it was cold.
It was so
It was
nice.
cold.
So we're going to try to get Chris, who's the cameraman behind the camera, to go back to nursing school because that was
Yes.
his passion. And that's what B3N is about, supporting
see,
people
I'm
who
sorry.
want to have dang.
So
Just
Chris,
cut to the left.
He shared his experience with Robert Morris, and while I agree that as we the BSN is the ideal thing, I think there are other routes you can take to become a nurse. I think there should maybe be you have X amount of years to
Go back.
go back. So I wouldn't say we should necessarily get rid of all of the diploma or associate's degree programs because you might feel more comfortable in a program that's local, and necessarily a BSN program where you have a lot of other people who are not supportive, who you're the only one. You know what I mean?
Only one word. Say the words. It's Black History
the only
Month.
black person there. The only black person representing for everybody, and everybody on my back. So.
I mean, I understand that. I'm not saying, like I said, I don't think there's nothing wrong with the 2-year program because that's how I had to go. I had a
I
family.
did CCAC too.
Yeah.
So,
Okay, so we all did.
That's how I did
Yeah,
it,
so-
and made it work.
Yeah, I don't think there's nothing wrong with it, but I'm just saying nursing as a whole, when they talk about how there's too many differences and it's not the same across the board and we're not respected because of that, they might need to tighten it up some.
Here's the fact: we all take the same test.
In class.
We all take the same test, and if you want me to, college is expensive, and so without employer tuition, I don't really want to take a religion course, or I'm just being serious. I don't want to take a religion course.
Right.
And
Turn that back over. We love Jesus.
we love Jesus on Sunday.
No, I love Jesus every day. I ain't going to hell.
You know what I'm trying
This
to say.
is ginger round. I'm not going to hell.
I don't need a class on basket weaving.
Right.
For $1,000 or $1,200,
Right.
So I do see the need for other avenues and to become a nurse because, it is a good field. You can support your family. You don't want to alienate anybody. So, and because we all take the same, clearly it's a proven method. You can have a diploma and be an effective nurse. You know what I mean? So, and some of those nurses ultimately are better nurses because they have had so much more hands-on clinical. They know how to talk to the patient. They know what to look for. Their critical thinking skills are more developed than somebody who maybe went to a bachelor's degree program and was with the patient.
Okay, let's talk about that. I remember they did like a study saying, do four-year schools prepare their nursing students better? And for me, I am a hands-on person. I ain't trying to read that book. I'm gonna have to read it twice because
don't read it at
my
all.
ADHD kicked in, and I'm on Facebook. But honestly, because I'm a hands-on learner, it was easier for me to grasp it because I had clinical at least once a week. Do you know what I'm saying? And when you go to get your BSN after you already have your ADN, it's just a bunch of papers. It's just a bunch of theory and paper. So like you said,
side of it.
right. So like you said, if you go to a four-year school, a lot of it's going to be theory. And then after you get through, I guess, 2 years of theory, you start your clinicals. I'm not even sure, but.
No, there's no clinical. So I had an associate's degree from CCAC, and I went back to get my BSN.
I'm talking about if you go straight 4 years.
Like if you go to Pitt and do the 4 years.
Oh, 4 years.
Yeah.
Your last 2 years.
Yeah, your last 2 years.
Mm-hmm.
Listen, they tried to kill me at CCAC. Them teachers was mean. But that foundation I never forgot. Digoxin, listen, if you see a light above your eyes, honey, if that heart rate is below, 60?
60.
You in trouble. Toxic. I'll never forget it. It's the foundation that they give you. And that's what you're saying, and that's true. You need that foundation, and then anything you do after that is...
And so that's what, back to the thing about the schools not graduating as many people as that someone else believes they should. It's difficult. And you bust your butt, and guess what? It might not be for you. Yeah. I remember you could pass the whole semester, and you could pass the semester with it. That semester with an A. 2 days into the second semester, the next semester, you had to do a dosage calculation test. If you did not pass it, you didn't go on in that semester. Mm-hmm. They didn't.
A lot of people got messed up with that dosage calculation.
And they gave you 2 chances.
They sure did. Yep.
Okay, I failed it the first time. But you best believe when I went back, I passed it.
Listen, I failed it
and
the first time.
That's what I'm saying. And then people get tore up about failing that NCLEX. You gotta have a determination. Like, I'm going right back and I'm going to knock it out. I failed it the first time.
I know people who failed it several times, but it's about how much do you want it. Yeah. You've done the education, so just go back and you can take it indefinitely. Just keep going back.
I went to the Kaplan course.
Keep doing this $300 there. Who got that?
I mean, you don't, but. If that 300, if I got to take it 5 times and I get a job.
Well, let's talk about this. How they demote you when you fail those courses. That's demeaning. You can be toxic. I was the nurse, graduate nurse. Then they was like, you the aide. I was like, I quit.
The other thing that they were talking about with this, these people being upset is like and I'm not, I'm a little older. I ain't that old. But the sense of entitlement. That if I am here, then you need to pass me. If I have paid my money, then you need to pass me. Like, so I think it's a generational thing. Like,
this is an entitled generation.
Yeah, like pass me, or else. You know what I mean? Or I'm going to give you.
I'm going to the media.
I'm going to the media.
Wait a minute. When I was teaching at CCAC, the kids told me about how they put the teachers on the what? How got on there? That's like no, but they really will do that. They will rate you on that thing and
some schools have now taken that teacher evaluation piece away because because they're with social media and you're using it as a tool to because you didn't pass. I'm going to rip this to bash people. So
that's not okay.
Well, when Dr. Thornton was there, you ain't had that. You sucked it up, dearie, and you did your work. That's what it was.
Yeah, but you also owned if I didn't pass the semester, I'll try again. You know what I mean? I don't see that.
I almost went insane. Ended up on blood pressure medication.
It ain't no joke.
No, it wasn't. But I made it through.
Yeah.
It was important.
And it's important for us to let everybody else know, like, coming from where we came from, you could do the same thing.
I
So
worked as a CNA
I was an
and
aide.
went to school. Yeah.
I wasn't an aide when I was a
But
student.
I think being an aide also made me a better nurse.
Absolutely, probably. Yeah.
Yeah, I wasn't afraid to touch people. I wasn't afraid to talk to people. And I understood that most of our patients just, like I was talking about at Seven Springs, that people want to be heard. They want to know that you hear them. You might not be able to solve the problem, but at least you hear me that and acknowledge that I do have a problem. You know, and maybe we can come up with a solution, maybe not, but you sitting there listening is like, man, does such a world of good. And you get a lot of these advanced practices that haven't been on the floor and held a hand and they're looking at them like,
Now wait, now we're gonna talk about these doctors who be checking their
They're
heart rate
worse.
without the stethoscope in their ears.
how about
I
that?
ain't saying their names, but
And won't even, I don't know if they touch you anymore.
it's quick.
You remember that doctor that used to stand at King outside their door?
Listen, that's who don't got the stethoscope in his ear. Now, hey, we're done. That's it, and that's enough. But you ain't listening to that. The heart could have stopped. You ain't heard that because it ain't in your ear, sir. Please, sir, put it in. And don't let it be an isolation. Honey, you okay? Okay. That's what he would do. He'd be like, Quincy, go on in there. Sheesh. But hey, that's what
outside the room.
from outside the room.
That was his visit. Oh, that was terrible.
But we're gonna wrap it up. We just want to empower nurses. We're gonna be back again for Nurse Chat. This food was good. Y'all don't know what we went through to get this little meal together, but it was good. And any parting words, ladies?
If you're going to school, keep your head up and keep moving forward.
Yep. Stay encouraged.
Yep.
And if you're an African American nurse, potential nurse, and you need support, please join #B3N. Our website is www.b3ns.biz. And remember, your patients need to see you out there. They need to see more of us so that they can trust the medical community. I'll talk to you guys later.